Welcome to the Human Services Committee. I'm Chair Judy Hopkins, and our first order of business is to call the roll.
Mrs. Hopkins.
Here.
Mrs. Burdick.
Here.
Mr. Barnes.
Present.
Mr. Decker. Mr. Havey.
Here.
Mrs. Root.
Here.
Mr. Stockin.
Here.
Mr. Crandall. 6 present.
Thank you, Tiffany. Okay, our first order of business today is to approve the minutes of October 6th, 2021. And there is an amendment on that already. On page 5 of the October 6th meeting, the minutes of the request of the Office of the Aging to accept a donation from the Senior Foundation should have reflected a referral to Ways and Means rather than a request for a resolution. So I would ask for a motion to approve the minutes as amended. Mrs. Burdick and Mr. Havey, thank you very much. Any discussion or questions? Okay, all those in favor, please say aye. Aye. Thank you. That is passed. Okay, we're changing the order of business a little bit from the printed agenda. Edna Kays is going to be our first speaker. Edna is on her way to a meeting in Albany and must leave at sooner time to be able to get there. So that's been approved by all of the other department heads to allow her to go first. So we do have a big agenda today. You will find her report on page 115, excuse me, of the agenda. We do have a lengthy agenda today that is 150 pages. I think that's a record. I'm sure you've all read them, right, committee members? Yeah, thank you, Mr. Barnes.
I read it, took me 3 hours plus, not counting the time I fell asleep.
Thank you, sir. Okay, and thank you for being with us today, and go ahead with your report.
Well, thank you for the consideration and allowing me to go first. Monthly report, do you have any questions on that? I know that last month I shared with you about the ARP monies for utilities, up to $10,000 per household for folks that qualify for HEAP, and that those lists were sent to us directly from the utility companies. At the last count, there was 1,072 applications. We fill out those applications for the recipients. We process them for the recipients. And at the end of last week, we had 279 recipients that we had processed for around $474,000. So the lowest amount was 34 cents so far. That's the lowest amount. So we processed an application for 34 cents. It probably cost more in staffing time to process a 34-cent application, and the highest amount was $29,000. And that application, of course, received the $10,000, but would still be in debt for the $18,000. So those are coming along. There is administrative funding for that, although I'm not clear on the administrative funding. I've talked to a couple of my co-commissioners. They're not clear on that funding. We're hoping to find out the answers tomorrow on that.
Thank you. That is certainly a significant amount of money to be dealing with on that. Any questions about that issue? Okay, go ahead, Edna.
So I'm requesting to fill a senior caseworker position. You're going to find a theme. We received a resignation from one of our senior caseworkers. We certainly wish her the best. She was able to secure herself a position at a school.
Okay, so this is actually your second MOE, everybody. We'll come back to the paralegal, Edna, after that.
Okay.
We'll deal with this one now. We have been advised by the county attorney that we do need to deal with these contracts and issues separately, and so we'll proceed. Go ahead.
The annual salary of this position is $42,415 to $53,254. The source of funding for the position is 35.57% county, 21.89% state, 42.54% federal. And it is in the current year's budget.
Okay, we'll need a motion. Mrs. Root, second by Mr. Stockin. Any discussion or questions about this? Okay, if not, all those in favor, please say aye.
Aye.
Any opposed? The motion is passed. Thank you. Let's go back to the paralegal, Edna, so we can take care of that one.
So I don't have that particular one with me. I guess I wasn't clear on where we were going with that, so please excuse me for that. But I am requesting to at least create a paralegal position in the department to help with the legal, with the attorneys in our department working on legal matters. I don't have that sheet with me. I guess I
To
wasn't clear on
fill,
that.
you mean, so you just want to create it today?
Yes.
Okay. Is that okay, Madam Administrator?
It is.
Okay, okay. Okay, so the motion would be to create
Yes.
the position of the paralegal in social services. May I have a motion on that, please? Mr. Havey, second by Mr. Barnes. Any questions about the,
Madam Chairman,
yes, Mr. Graves?
I have a question for Edna. We just hired 3 attorneys for your office, Edna. We need a paralegal?
We hired one attorney
I thought there were 3,
and we've contracted with 2 others
2 others.
that are both part-time. And the paralegal can help us with the petitions and the legal matters that need to be put together.
Is it going to be paid for with a grant, or can you back bill for her?
I don't know if there's a backfill for that.
No, I meant back bill the state for.
Oh, yes, there's a portion, but I don't have that sheet with me.
Yes, and we have not increased the amount of attorneys that are currently working for
No.
us. We have the same, or actually fewer attorneys overall between the county attorney's office and DSS than we had. We just have vacancies, hoping that we'll get applications and can figure out where the positions stay, whether DSS or county attorney.
So basically, this position will have minimal impact on the taxpayers. Is that the case?
I don't know. Do you?
The MOE, Edna, says 46% county, 5% state, and 49% federal. So about 54% of it will come from the state and the feds, Carl, and the rest will come from the county.
Thank you, Edna.
The other thing that might be important to note is that 2 secretaries exist in the county attorney's office. One normally helps the county attorney do board matters. The other one normally helps with DSS work. That one has been loaned out to Edna to help with DSS work when we created those DSS attorneys. That person is likely filling the vacancy that we just gave the district attorney permission to fill. So they'll be down to 1 attorney, and hopefully this paralegal will help Edna in DSS pick up some of that slack in the meantime. So we won't be up a body right now either, so.
Okay, Mr. Healy?
Yes, Madam Chairperson, I'd just like to say it, after giving this a little thought there, I think that this measure will improve the overall efficiency and cost effectiveness of the Commissioner's Department there. And I think it's a very positive process that we're going through and helping out her department in this matter. Thank you.
Okay, thank you. Thank you. Any other comments or questions? Okay, if not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. That is to create that position. Okay, and let's see here, then. Okay, well, the next one would be the caseworker, and that is on page 122.
So we have a caseworker position, and we'd like to fill that with any resulting backfills. Due to a resignation, I'm going to stay with my theme because this person has located a job in the school. So we wish her the best. The annual salary is $41,309 to $51,537. The source of funding is 35.57%, county 21.89%, state or federal, I'm sorry, I got this all backwards, 42.
No, you had it right. It's 21,
4%. Okay,
21.89 state.
and that's currently in the budget.
Yeah. Okay, we'll need a motion to start that. Mrs. Root, thank you. Mr. Havey, seconds. Questions, discussion about this position? Okay, if not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay, and the next one would be the Senior Social Welfare Examiner on page 123.
Staying with the theme, this is due to a resignation and any resulting backfills. This employee has left to go be employed at the school, at one of the schools. We, of course, wish her the best. And the annual salary for this position is $37,665 to $45,824. 38% county, 10% state, and 52% federal is the funding for the position.
Okay, thank you. And you need a motion to start that, please. Mr. Havey. Oh, and Mrs. Root. No. I'm getting sign language here, but, okay. Mr. Stockin. Okay. I'm looking all over. Okay, questions? We should just mention too that this position is responsible for supervising several social welfare examiners and verifying the eligibility of temporary assistance programs. So a very needed position to fill. If there are no other questions, please signify by saying aye if you approve this.
Aye.
And any opposed? That motion is passed. Thank you. Okay, and the next one is to fill 2 social welfare examiner positions, and that's on page 124.
So I'm asking for 2 welfare examiner positions, one due to a resignation and any resulting backfills. One of those resignations came because Tyler took our worker.
He seems happy about it.
And the other position is the position that we held back and did not fill during the COVID months. And our workload has significantly increased and we're really needing that help. So I hope that you would give that consideration. The salary of the position is $35,361 to $42,979. Funding for the position is 38% county, 10% state, 52% federal. And these are the people that are responsible for interviewing the clients and determining the eligibility for the benefits.
Okay, motion by Mrs. Root, second by Mrs. Burdick. Any questions about these positions? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, Edna. You've had quite a turnover in staff recently.
It seems that way across the state, I guess.
Yes.
It's hard to fill positions.
Yes, I'm sure. Okay, we have a number of contracts that we need to look at for DSS. The county attorney has advised us that we do need to deal with them separately, individually. And actually, if you will notice that he also has advised that we pass them upon review and approval of the county attorney. He has not had a chance to look at them all. Is that correct, Mr. Minor? Okay. So each one we would have that stipulation on them. Okay, so the first contract, if you want to share a little bit about that one, that is with ACASA.
So we are requesting to approve the contract for the January 2022 through December 22 with the Allegheny Council on Alcoholism and Substance Abuse for comprehensive addiction and recovery. It's a position for screening adult applicants for public assistance. If we have a reason to believe that there is use, we screen and connect them with service programs. The appropriation number is there. The fiscal impact is 100% federal reimbursement for the comprehensive addiction and recovery, and the drug and alcohol services are reimbursed by case count at either 100% federal or 29% state.
Okay, and this is a contract that you have held for the last few years, is that
Yes.
correct? Okay. Okay, we need a motion to start that, please. Mr. Havey, thank you. Second by Mr. Stockin. And any questions about this contract? If not, all those in favor, please say aye.
Aye.
Any opposed? The motion is passed. Thank you. The next contract would be with, get my glasses here. It would be with Accord for non-residential domestic violence, and that is on page 126.
We're requesting a resolution to approve this contract for the year of '22 with Accord for non-residential domestic violence services. They provide services to DV victims to support and assist them with maintaining personal safety, achieving self-sufficiency, and that's completed through case management, orders of protection, and accompaniment through the court process. It's 100% federal reimbursement, and there it is.
Okay, I need a motion to start that. Mrs. Root, second by Mrs. Burdick. Any questions? Okay, if not, all those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you, Edna. And the next one is also with Accord for Women's Chances on page 127.
Yep, we're asking for a resolution to approve this contract for the year of 2022. This contract provides the Women's Chances Group, which is 18 weeks of domestic violence education to be able to learn to identify forms of abuse, to avoid future abusive relationships. It's 100% federal reimbursement.
Okay, thank you. Need a motion on that. Mrs. Burdick, second by Mr. Havey. Any questions about that? If not, all those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. Okay, and the next one is to renew a contract with Accord, and I'll let you say the initials.
For the part of the CARES Act, the ESGCV funding, both DSS and Accord are members of the Homeless Housing Task Force, and between DSS and Accord, those services are split. DSS completes the emergency shelter portion, and Accord administers the prevention and rapid rehousing, and then works to help clients prevent homelessness and or eviction with rental assistance, which has been difficult to use this funding. I think we've talked about it in the past because nobody was being evicted. Although there are people being evicted a little bit now, but it's 100% federal reimbursement under the CARES Act.
Okay. Okay, thank you. We'll take a motion on that, please. Mrs. Root, second by Mr. Stockin. Any questions about it? Yes, Mr. Barnes.
Talking about eviction, you say some evictions are now occurring?
Yes, some evictions can occur if you're being evicted for reasons other than COVID-related inabilities to pay for your rent, but you could be very disruptive, you could be destroying the property or something along those lines, you can be evicted under those circumstances.
So if they're not paying their rent, but they're good tenants, they can't be evicted. And is there any hope that the landlords will ever get reimbursed for the months and months and months that have not gone without any rent payment?
So we've talked about Ewrap. I know it's a rental assistance program where tenants can apply to have that back rent paid. And as long as the landlord is a part of that application process, then that money will be sent directly to the landlord once that process is approved, once that application is approved. And the landlords also have to fill out some information as well. If a tenant then goes to, if a landlord doesn't participate in that, and the landlord takes the tenant to court, the court would ask the landlord if they had participated in that, and then required if the tenant has made application. But even if the landlord hasn't applied or has not been a part of that application process, they will hold on to that money for 18 months, hoping that the landlord's 100, or is it 18 months or 180 days, hoping that the landlord will step in and join in the process.
So this money is that both federal and state money?
All CARES Act money,
So it's all federal money
Yes.
going through the state?
yes.
And why is it taking so long for landlords to get payment?
So that's really out of my wheelhouse. That's an OTDA issue, and I think that recently I think that you saw the commissioner of OTDA was let go by our current governor, so I'm not, but maybe I'll get some of that information tomorrow, but I don't really know the down dirty details about that.
Okay, thank you very much.
Okay, thank you. Any other questions? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. The next one is to renew a contract with Melissa Ball, Qualified Individual Evaluations.
So you did recently approve a contract with Melissa for QI evaluations that would end in December of 2021. The QI services are evaluations of children entering into what we once termed residential treatment. They have to be evaluated before or within 30 days of being placed in a residential treatment facility. So this is for the year of 22. It's 42.54% federal reimbursement and 21.89% state reimbursement of expenditures on non-Medicaid billable funds.
Okay, motion by Mrs. Root, second by Mrs. Burdick. Okay, and any questions? If not, all those in favor, please say aye. Aye. Any opposed? That motion is passed. Thank you. And next, we have a renewal of a contract again with Berkshire Farm Center and Services for Youth on page 130.
This is another service that Berkshire provides for the county. It is a school and home-based prevention program that provides services to youth who have been identified as chronically truant from school. It focuses on the cause of that and seeks ways to improve that attendance in school. It's 100% federal under flexible funds.
Okay, we'll take a motion on that, please. Mrs. Burdick, second by Mr. Stockin. And any questions? All those in favor, please say aye. And opposed? That motion is passed. Thank you. Okay, and we need to turn the page on the agenda. So the next one is to renew a contract with Berkshire again. We'll let you tell us about that.
Same as with Melissa for qualified individual evaluations of children being placed in residential treatment programs. It's 42.54% federal reimbursement, 21.89% state reimbursement of expenditures on non-Medicaid billable funds.
Okay, we'll take a motion, Mrs. Roots. Second, Mr. Havey. Any questions about that? Mrs. Burdick.
I think I've asked this before, Edna, but some of these places are quite a distance away from Allegheny County. So when you have to take a person for evaluation, who does it and who pays for it?
So it depends on where the child is placed. We don't have any residential treatment programs in Allegheny County. They're spread throughout the state. So one of these QI contracts that we're talking about might be close to where that child is placed. And then what they need to do is they need to do the evaluation on the child and also look at the team of players, like it might be part of the department, the family, get everybody at the table to try to figure out what's best for the child to qualify that placement. It is paid for. The parts of the evaluation are paid for by Medicaid, and outside of that, there's reimbursement for that. And so we really want to have QIs that can bill Medicaid. So that's another reason why we're trying to flood our market on that, so we have more options. Plus, we share all of those QIs with all of the other counties in the state. So we want to make sure that we have availability because we have time constraints did I go too far? But to time constraints to getting those evaluations done.
So who physically takes the child to that location?
So it depends on the placement itself. They're generally JD placements. So it depends on the child. Sometimes the sheriff's department might take them. Sometimes we might take them. Sometimes a parent might take them. So it depends on the situation. Yep.
Okay. I think we're ready for a vote on that. All those in favor, please say aye. Aye. Any opposed? That is passed. Thank you. Okay, next we have an addendum that is to the agreement for purchase of foster care for children. It's on page 132. I'm going to ask Tiffany to share a little bit about this one. Just that it's inserted.
Yep, it was just a late addition to the agenda.
Okay, and it is in your packet. So, do you have that, Edna?
That's again for QI services?
Yes.
For Berkshire?
Yes.
Yes.
Okay. Okay. So do we just need a motion on that? Mr. Havey, second by Mr. Barnes. Questions? Mrs. Root is looking puzzled. Do you not have it in your packet? Okay. 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 All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Okay, thank you. Okay, the next several are renewal of contracts of ones that we have had in the past, but we will deal with them individually. The first one is to renew a contract with Jason Burrows for homeless apartments on page 138.
So this is housing for our homeless. It's managed by our homeless unit. The housing is temporary until permanent housing can be found to develop a plan for the person or family and a plan for goals to achieve permanent housing. It's 42.54% federal reimbursement and 21.89% state reimbursement.
Okay, do we have a motion on that? Mrs. Root, second by Mr. Stockin. Any questions? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. The next is a contract with Pam Duttweiler, Sign Language Services.
And that's exactly what it is. She provides our sign language services with people that may have hearing issues. It's federal and state reimbursement depending on the program area of the client who is assisted with that representation.
And this is as needed. I mean, she
As
doesn't-
needed,
As
yes.
needed, right. So a motion, please. Mrs. Burdick, second by Mr. Stockin. Again, these are, if we need the service, we have the contract in place so that we can go ahead with providing the service. But they do not get paid unless they are giving the service. So any questions? All those in favor? Any opposed? That's passed. Thank you. The next one would be Hillside Children's Center, One Family and Home Parenting, page 140.
So this is a contract for 2022 that that meets two services that Hillside provides. One family service, which is family meetings with the families to develop solution-focused plans that will address concerns regarding why children are placed in foster care or to prevent children from being placed in foster care. The in-home parenting piece of this contract provides work with parents to improve parenting skills and have successful visits. It's also a visitation piece with children that are in foster care, and helps provide parenting services while visiting with their child. And it assists also with preventing placement of children that are not in care. It's 100% federal reimbursement up to the Title 20 allocation, and 62% open-ended state reimbursement after federal allocation is maximized. That's a long story.
I guess so. But they're paying. They're the ones that are paying. Mrs. Root, motion, second by Mr. Havey. Thank you. Questions? All those in favor? Any opposed? That is passed. Thank you. Next would be Jan and Bev's.
This is for the provision of home health care and personal care services. Nursing supervision for personal care is defined by the New York State Department of Health for those receiving Medicaid. Expenditures are part of the Medicaid cap calculation.
Okay, thank you. Need a motion, Mrs. Burdick, second by Mr. Stockin. Any questions? All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And next is the Laboratory Corporation of America Holdings, page 142.
This is for the child support unit to complete genetic parentage testing. It's 66% federal reimbursement.
Okay, motion by Mrs. Root, second by Mrs. Burdick. Any questions? All those in favor, please. Any opposed? That motion is passed. Thank you. Next, we have I'm sorry, my glasses are not working right for me here. The legal assistance.
So this is, I don't believe it's on your MOE, but it's for $10,000. It's for representation to assist with assistance recipients who have been denied Social Security Disability or Supplemental Security Income, SSI. Its federal and state reimbursement is dependent on the program area of the client who is assisted with legal representation.
Okay, thank you. Need a motion, please. Mr. Stockin, second by Mr. Havey. Any questions, please? No? All those in favor, please say aye. Any opposed? Motion is passed. Thank you. The next one would be the Parent Education Program, page 144.
So this is the Families First program. They provide in-home counselors to work with families to improve parenting to prevent child placement in foster care. 100% federal reimbursement up to the Title 20 allocation, 62% open state reimbursement after the federal allocation is maximized.
Okay, motion, Mrs. Burdick, second by Mrs. Root. And any questions? All those in favor, please say aye. Any opposed? That motion is passed. Thank you. Moving right along to another parent education program.
This is for the Families Together program, personal favorite of mine, just saying. It's to provide immediate intensive in-home counseling services that are available 24/7 for a maximum of 10 hours a week in the home to prevent placement of children in foster care. It's 100% federal reimbursement up to the Title 20 allocation, 62% open-ended state reimbursement after federal allocation is maximized.
Okay, need a motion. Mr. Stockin, second by Mr. Havey. Any questions?
Looks
All
like
those
the,
in, I'm sorry?
I was gonna say, it looks like the appropriation account number's missing a zero. We'll add that in there.
Okay, do we need to change something, Brenda?
I was just remarking that there's a zero missing in the account number, but we
Oh.
can add it in.
Okay, thank you.
Oh,
Thank you.
sorry.
That's okay.
That's okay. Yes, thank you for catching that. I think we're ready for a vote. All those in favor? Any opposed? That is passed. Thank you. Okay, and next we have the Ready,
Youth Services.
yeah, page 146.
This is to assist children and families with a transition from foster care to home. It's aftercare services. It's 100% federal reimbursement up to the Title 20 allocation, 62% open-ended state reimbursement after the federal allocation is maximized.
Okay, we need a motion, Mrs. Root. Thank you. Mrs. Burdick, seconds. All those in favor, no, I'm sorry, questions. Okay, all those in favor, please say aye. Any opposed? Okay, thank you, that is passed. The next one is also for the same organization.
Yep, and this is for community-based mentoring. It's working with adolescents ages 4 to 17 and families to develop skills that will assist with emotional symptoms, conduct issues, ADHD issues, peer and social issues. It's 100% reimbursement up to the Title 20 allocation, 62% open-ended state reimbursement after federal allocation is maximized.
Need a motion, please. Mr. Stockin, second by Mr. Havey. Any questions? I know this is an ongoing contract that we've had, Edna. Have we used them recently?
Yes, we have, and we also share, and probation also has that same contract.
Okay, I'm just noticing it's from Ohio, so I'm just wondering.
Yes, their main office is in Ohio, but they do have services in an office located here in Belmont, actually.
Oh, excellent. Okay, good. Thank you. Okay, yes, Mr. Barnes.
I have a simple question. What page are we on now?
I'm sorry. Page 147, I believe.
Okay.
It's hard. It's hard to we appreciate the pages being numbered on this. I don't think we've ever had an agenda this large. Okay, so did we have a motion on that? I don't think so yet. Yeah, the second ready one. Yes, we did. Okay, thank you. Are we ready for a vote on it? Did we vote? Okay, I didn't think so. It's a little confusing. Okay, all those in favor, please say aye. Any opposed? That is passed. Thank you. Now we are on to the Southern Ontario Traveling Teacher, page 148.
Yep, this is for TANF recipients receive this service to work on their high school equivalency. It's a tutoring program or to help with job readiness or job retention services in an effort to have people be independent of TANF services. It's 100% federal reimbursement under flexible funds for family services.
Okay, thank you. Motion by Mrs. Root, second by Mrs. Burdick. Any questions on this one? All those in favor, please say aye. Any opposed? That is passed. Thank you. We're moving on to the WillCare Incorporated, page 149.
Same type of contract as Jan and Bev's was earlier. It's nursing supervision activities to assure personal care services are provided, personal care aid assignments, and that's expenditures are a part of the Medicaid cap calculation.
Okay, thank you. We'll need a motion. Mr. Stockin, second by Mr. Havey. Any questions? All those in favor, please say aye. Aye. Any opposed? That motion is passed. Thank you. The next will be the cooperative agreements with the Allegheny County Attorney's Office.
So we are on to the cooperative agreements. So that's good news. We're more than halfway there. So
Oh, don't tell him that. the whole quorum will get up and leave.
This is a cooperative agreement between social services and the Allegheny County Attorney's Office. It is for this current year, 2021.
Okay, ends in a little over a month. Need a motion, please. Mr. Havey, second by Mrs. Root. And any questions about it? All those in favor, please say aye. Any opposed? That is passed. Thank you. The next one is with the Sheriff's Department. answering services and security services. And that is on page 151. Need a motion? Mrs. Burdick, second by Mr. Havey. I'm sorry. Ms. Gaze, I didn't give you a chance to say a little bit more about it.
That's okay. It's for the after-hours answering service. Federal and state reimbursements, all generated based on what the program use is. Did we miss the county attorney one for legal services to support staff? One we did child support, and one is legal services for the rest of the department.
I just have one listed.
Oh, you just have one? I have
Yeah.
two, so.
I see it says legal services and legal services to support staff.
Oh, it says, yeah.
Does
Yeah.
that need to be separate?
I have two MOEs, so I don't,
They are two separate contracts.
Okay, so we need to vote on them separately, Madam Administrator?
Since you're voting individually on each contract, then probably yes.
Okay, so can we say that the one that we voted on was for legal services to CSEU, and that was passed, and now we'll vote on one to legal services to support staff?
yes.
Is that agreeable? Is that legal? Pardon me?
Didn't you say it was a separate MOE?
Yes, I have them as two MOEs.
The first, the MOE that's in the packet is for legal services and support to staff. It's $524,365.
The one I have is for legal services and support staff to child support unit for $77,000, and then I have one for legal services to support staff for $524,000.
Yeah, Edna, I don't think that second one for support.
It's in here.
Yes, so they're
I
only
apologize.
seeing the one for 524,365, but you have two separate agreements you do
Yes.
with the county attorney's
Yes.
office every year.
Yes, and it's for the year 2021. These are for the year 2021. The cooperative agreements are for 2021.
What would you recommend, how would you recommend we handle it, Madam Administrator? Do you want to just start all over on them?
I think, so you're looking at one MOE right now that's in your packet. I think a motion and a vote on that one. And then I think Edna probably could tell you what the second one is. And you could make a motion and vote to do that, and she'll make sure that MOE was included. I might have just slipped out of this packet. This is a very long packet. I'm sure it was just inadvertently left out.
Wow, we were really at a good clip.
Yeah, yeah. So. Okay. All right, can you give us a page number on that one so everybody can be on the same page? Literally on the same page. It's not in my packet.
Madam Chair, your page numbers are not the same as our page numbers that we have here.
Okay, I know apparently there are two different packets. I know I was given one with the corrected page numbers. I'm sorry you don't have that. So I won't give page numbers anymore. We'll try to be a little bit more specific, but we're in the home stretch here.
If you grab the agenda that's posted on the website, that's been updated.
One important thing.
Well, we were tracking really well.
Yeah, we were.
It wasn't a problem, we were tracking really well.
Say that again, Mr. Stockin?
144 was 524,265 amount.
Okay, I don't think everybody heard you though. 144, you said?
Yes, ma'am.
Okay. All right.
144, square root of 12. What?
It's going south.
That's the one we just did. Right.
Okay. So Mrs. Knapp is suggesting that Edna tell us about the next one, but we don't have anything in writing. Is that correct?
So if it helps,
do that?
I can tell you, she did submit it. It just inadvertently was left out of the packet. It's an MOE requesting a resolution to approve the January 1, 2021 to December 31st, 2021 cooperative agreement between DSS and the Allegheny County Attorney's Office for legal services and support to staff-specific child support enforcement functions. That amount was $77,185.
Okay. Okay, are we good with that? Okay, Mr. Havey, second by Mrs. Burdick. Okay, Tiffany, are you all good with that? Okay, super, thank you. Okay, any questions? If not, all those in favor, please say aye.
Aye.
Any opposed? That is passed. Okay, so now, I hesitate to say, but I believe we're on the contract with Allegheny County IT Department, IT support.
Sheriff's
Sheriff's?
Department.
Okay, I know we were gonna do the sheriff's, but we didn't do it. Okay, okay. So this is the Sheriff's Department answering services and security services.
This is the Sheriff's Department for after-hours answering. And it's federal and state reimbursements generated from all program areas.
And this has been ongoing. Motion by Mrs. Root, second by Mr. Havey. Questions? All those in favor, please say aye. Any opposed? That is passed. Okay, the next one then would be the IT department.
Well, now I have another one for the Sheriff's Department for the security services.
It's two separate?
Yes. It's like the last one. I think they were just put in the same, it looks to me like they were put in the same line of the agenda, but there's one for the answering services and one for the security services.
And Edna did submit this MOE, it just is not in the packet, but I do have it as well.
Okay, so how do you want us to do it?
You could do it the same way, and I can tell you she's requesting a resolution to approve a contract, a cooperative agreement from January 1, 2021 to December 31st, 2021 between Social Services and the Allegheny County Sheriff's Department for security services in the amount of $165,507.83.
Okay, thank you. We need a motion on that. Mr. Havey, thank you. Second by Mrs. Burdick. Thank you. Any discussion about this? Yes, Mrs. Burdick.
Can you explain why these contracts are from January 1st of this year to the end of this year? Why
All
aren't,
cooperative agreements are done at the end of the year of that calendar year. It's the way the state runs them. We don't have a choice.
It's
The-
crazy, but
The state has to approve the budget and the budget amendments every year. And these cooperative agreements obviously are services that other offices provide to DSS, and then DSS is billed for those services and acts as a pass-through for state money to come to the county for those services. So for this one, the sheriff's has provided security services to DSS, and they'll get a pass-through through DSS for their budget.
And that's all the cooperative agreements are that way.
so do you have an agreement from January 1st then? I mean, are you covered?
Yeah, so these, we don't bring these to you until they've been approved by the state.
thank you. Okay, I think we need to vote on that one. All those in favor? I believe it's passed. Okay, and then, Carissa, would you be able to read the second part of the second MOE that we, I don't think we have that one?
I think you just did both of them for the sheriffs, and you should now be on to the IT one. On page 146 of your agenda.
Hooray. Okay, my agenda. Okay, so the IT department, IT support, you want to say anything else about that, Edna?
No, that's just for the communication services and the support that we receive from IT.
Okay, super. Yes, Mrs. Root, thank you. Mr. Socken seconds. Any discussion? Any comment from our IT department? Okay, certainly. All those in favor, please say aye.
Aye.
Any opposed? That is passed. Okay, and then we are on to the Allegheny County Employment and Training Center.
So this is to assist the department with employment services to the temporary assistance of clients. It's 100% federal reimbursement for TANF and 100% federal reimbursement for food stamps and 100 or 50% reimbursement for food stamp employment and training activities.
Okay, thank you. I need a motion. Mrs. Burdick, second Mr. Hamby. Any questions? All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. And now we're moving on to the district attorney.
So the district attorney's office is a cooperative agreement for the prosecution of fraud cases that occur within the department. It's 100% federal reimbursement for TANF and 50% federal reimbursement for SNAP.
Okay, thank you. Motion by Mrs. Root, second by Mr. Stockin. And any questions? All those in favor? Any opposed? That is passed. Thank you. We have a contract then with Dr. John Coyne for medical services.
So we made it through the cooperative agreements.
We did.
We did. So this is the next few contracts are for the Child Advocacy Center. This is a contract with Dr. Coyne for the supervision of the St. P nurses. It's 100% federal reimbursement from the OVS CAC grant.
Okay. Any motion? Mr. Stockin, second by Mr. Havey. Questions? All those in favor, please say aye.
Aye.
Any opposed? That's passed. Thank you. We'll move on to Cheryl Wire.
Cheryl is a sexual assault nurse examiner, pediatric for the Child Advocacy Center. It's 100% federal reimbursement from the OVS grant.
Okay. Motion by Mrs. Root, second by Mrs. Burdick. Questions? All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. Moving on to contract with Nicole Steinhauer.
This is also a St. A nurse, and it is covered by 100% federal reimbursement from the OVS grant.
Okay, need a motion. Mr. Stockin, second by Mrs. Root. Questions? All those in favor? Aye. Any opposed? Okay, that is passed as well. Contract with Olean General Hospital for medical services.
This is for medical laboratory and testing activities billed at the Medicaid rate, and it's 100% reimbursement from the OVS grant.
Okay, thank you. I need a motion. Mrs. Root, second Mrs. Burdick. Any discussion? I'm gonna check it, see if everybody's paying attention. All those opposed? All those in favor?
Aye.
Motion's passed. Good for you. We're so smart at this committee. It's great. Okay. Sorry, just trying to. Dr. Zuckerman contract.
Dr. Zuckerman does mental health consultation and works with children victims from the Child Advocacy Center. It's 100% federal reimbursement from the OVS grant.
Okay, thank you. Need a motion. Mr. Hamey, second by Mr. Stockin. Questions? All in favor?
Aye.
Any opposed? That is passed as well. And I believe that this is the last contract coming up for DSS with Cattaraugus County Sheriff's Department.
And this one is for the law enforcement coordinator that is placed at the Child Advocacy Center and works predominantly on cases in Cattaraugus County, and that is also 100% funded by the OVS grant.
Okay, and we need a motion there. Mr. Hamey, second by Mr. Stockin. Any questions? All those in favor, please say aye.
Aye.
Any opposed? Okay, all that is passed. Thank you. Okay. I have something else in there, but, Edna, if you don't have anything else, we will wish you safe travels.
Thank you.
And thank you very much for keeping us straight on some of those. Thank you.
Thank you. Thanks. Have a
Mr.
good
Stockin?
day.
Not sure where you were going, but while we're at the bottom of this list, could we do that other resolution that doesn't come directly from one of those next committees?
Are you looking at the Senior Foundation one?
Yes.
Okay, I believe that Anita will be covering that, yes? Or is this something?
Well, then I don't have to
This-
scroll through 150
The
pages.
acceptance and
Okay, sure.
appropriation of the
This is
donation.
number, yeah, this
Yeah.
is number 6 on the agenda. It's from, Brenda, do you want to say anything about this?
Sure, I'd be happy to. There was an error on Resolution 26621, so this is just a request to repeal that resolution and then make a correction to the account numbers as they're listed.
Okay, thank you. We'll need a motion on that, please. Mr. Stockin. Thank you. Mrs. Root seconds. Any questions about that? All those in favor, please say aye.
Aye.
That is passed. Okay. Take a breath. And we're going to go back up to the top of the agenda with reports from the Public Health Director and the Office of the Aging Director. Do you two have a preference as to who goes first? Okay, all right. Our next report then is going to be from Tyler Shaw, our Public Health Director. And we appreciate your being here and being patient, Tyler. Thank you.
No problem. All right, let me just get my bearings here.
Yes. I believe Tyler is going to be giving us an update on the COVID situation, as well as some of the highlights from his report.
Absolutely. So I'll start off with the COVID front. So I got lots of notes here, and I'm sure you'll have lots of questions for me. So we've seen quite the increase in our COVID cases lately. Our 7-day COVID positivity rate right now is 9.9%, which is the highest in the entire Western region. So we're not looking too hot in that category. We do have some increased testing availability through our school districts now. So all of our schools are on board now with testing their unvaccinated staff and faculty, and some of the school districts are offering symptomatic student testing as well. So we are seeing some increase in our resources for testing availability. Likely that will drive our numbers higher, but knowing that COVID is still circulating in our community at a pretty increased rate at this point. I did want to kind of highlight the booster doses for Pfizer, Moderna, and the Johnson & Johnson. To date, we've issued 104 Moderna boosters since last week, 15 Pfizer booster doses administered, and in total, the health department has administered 12,941 COVID vaccines. That's just the health department itself. It's not including pharmacies, not including the hospitals, and private providers as well across the county. I did want to say just a special thank you to all of our vaccine providers across the county. They've been great partners. Our school superintendents, our school nurses have been great during the pandemic, and especially our medical volunteers who have helped at our various vaccination clinics. So that was an important piece I wanted to include.
So to hear the large number of vaccinations that have happened sounds great, but do you have the percentage of people that are vaccinated in Allegheny County? Because it's probably not that high.
43.7% of the population with at least one dose, 51.7% of the 18-plus population with at least one dose right now. So we're steadily increasing day by day. We're still trudging along. We're still offering the opportunities for vaccinations and spreading the word. So.
Okay, thank you. I know I just had my booster shot the other day. It's easy. They do a great job here at the health department, and so I would encourage anybody else to do that and hopefully be safer from the COVID. Any questions for Tyler about COVID? Whoa, this could be a record. No questions. Okay. Why don't you go ahead with the rest of your report then, or anything
All right.
else that you want to say?
Nothing too special in our monthly report. We talked about the booster doses. You kind of see the communicable disease investigations out there. I did want to highlight our STI services increase from 22 last year to 65 this year, which could be due to programs opening back up from the pandemic as well. So it's just a little asterisk there. And then did want to highlight that we do have 3 new staff members joining us. We did hire a director of patient services. April Worth will be starting on Monday. And we did hire 2 registered nurses, one starting on the 15th of November, and one starting on the 17th of November. So
And certainly with all of these inoculations needing to happen, it's good to have those people on staff finally.
we'll see our immunization clinics hopefully come back on board in December. We did have to cancel those routine immunization clinics, which are very important to our schools and our residents. So we'll be hopefully getting those back on board as well.
Okay, thank you. Thank you. Okay, I guess we'll proceed then.
Okay. First on the agenda is the request to ratify my signature on the COVID-19 master agreement with Abbott. These are for our rapid ID Now test kits. We weren't able for the longest time to get these kits. We were able to secure them, so I had to act pretty quickly to jump on them to get this going. So
Okay, okay, thank you. Well, we'll need a motion for that, please. Mrs. Root, second by Mr. Havey. Okay, any discussion about that? All those in favor, say aye.
Aye.
No opposed? That is passed. Thank you. Go ahead, the next one.
all right, next is an approval of an agreement with Jones Memorial Hospital with our lead poisoning prevention program as well as our tuberculosis control program. These are renewals of existing contracts with Jones.
Okay, thank you. Very important. Mr. Havey, motion, second Mrs. Root. Questions? All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. The next one.
All right, next is an approval of our lease agreement with Jones Memorial Hospital for our WIC building. Jones recently purchased the building, so we are entering into a lease agreement with the new leaser.
That's good news, too.
Yep.
Yes. Motion by Mr. Stockin, second by Mr. Havey. Any questions? All those in favor, please say aye.
Aye.
That is passed. The next one is with Cattaraugus Community Action.
So this is a request for approval to enter in a sublease agreement with Cattaraugus Community Action for an office space that they lease in the WIC building that is paid to our WIC program.
Okay, thank you. Motion, Mrs. Root, second by Mrs. Burdick. Any discussion? All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. Next one is medical transport, I believe.
We're requesting permission to enter into an agreement with Medical Transport Services in order to assist with our free COVID-19 rapid testing public clinics. We are looking to ramp these back up. We know this is a huge community need right now for testing. And our plan is to use some of our COVID-19 vaccine admin fee revenues that we've received from administering the vaccines to fund this venture.
That's great. You're basically putting the money back into the system. That's great. Motion on that, please. Mrs. Root, second by Mr. Havey. Discussion? All those in favor, aye.
Aye.
Any opposed? That is passed. Thank you, Tyler. Next one.
All right, we're looking for an approval for an agreement with our preschool program for preschool services for a school psychologist, which we're always looking for providers, so this is a good thing.
Right, right. Any questions on that? Or excuse me, we need a motion. Mr. Havey, thank you. Second, Mr. Stockin. Discussion. All those in favor, please say aye.
Aye.
No opposed, that is passed. Next, another occupational therapist.
Yeah, we're looking for a request to approve this service provider and evaluator contract for an occupational therapist for our preschool program.
Okay, I need a motion on that. Mrs. Burdick, second by Mrs. Root. And any discussion? All those in favor, say aye.
Aye.
Any opposed? That is passed. Thank you. And the last one that I have here on my list, the COVID-19 vaccine administration revenue.
Yeah, so as I explained in the previous request, we received approximately $289,000 in revenues from billing insurances for the COVID-19 vaccines. So we were looking at what costs we had in A2025, which is the COVID cost center for the county. So we're just looking to appropriate those revenues across these various line items.
Okay, Thank you. Need a motion? Mr. Havy, second, Mr. Stockin. Any questions? All those in favor, say aye.
Aye.
Any opposed? That is passed. Thank you very much, Tyler. Any other things you'd like to bring to the committee today?
If you haven't got your flu shot yet, it's a good time to get your flu shot. We are seeing an increase in flu cases as well. So if you haven't gotten that, we do have a couple clinics that aren't full yet. And then if you haven't received your booster and you can't get into a certain slot, it's been pretty busy, but we'll have more booster clinics. So just hang in there. We'll get those out the door too. We have more at the end of November as well.
And those are all listed on the county website,
Absolutely.
correct? Okay, yes, Mr. Barnes.
Times Herald has had front page articles covering Cattaraugus and Allegheny County deaths and, cases and new cases and deaths. So where is it that we stand right now on total deaths and are the number of deaths in October and into the early November, are they still increasing?
Yeah, so total right now, tracking through New York State's numbers, 103 of our residents have passed away from COVID-19. We track internally the death certificates that we can verify here at the county if they die at a county facility or somewhere in Allegheny County. Those deaths have definitely kind of increased with this surge that we've seen in the past month. So just in the past month, I think we've had 4 or 6 deaths.
And they're all, as I see it, they're all in their 70s and above, maybe 60s. I was under the impression that most of these people had gotten a shot. Is that true, or is my thinking was that most of the people that haven't gotten shots were in the 20s, 30s, 40s, in that neighborhood, and that almost everybody in the upper scared to death and went ahead and got the shots, but that apparently is not true.
No, we have a lot currently in the hospital admissions. Even I'd say greater than 85% are unvaccinated that are sitting in the hospital.
Unvaccinated.
Unvaccinated. Yep. We've had, I think, 1 or 2 individuals that were vaccinated that were in the hospital. And that was possibly due to other ailments as well.
And most of these deaths have COVID, but there are other related physical ailments that contribute to their death?
Some. I'd say that's why we usually put on our press releases, we're very careful with our wording when we say a die as a complication of COVID-19 or a consequence of. So if you look at a death certificate, there's events that can lead to the final cause of death. And that could be anything related to COVID-19. Yep.
Thank you.
Okay, thank you very much. Any other questions? Okay, Tyler, thank you very much. We appreciate getting that information, and you've been good about keeping us updated on all of this. So, thank you. Our final speaker today is Anita Madison from the Office of the Aging. Anita, we thank you for being patient, and we look forward to your report.
Thank you. A few highlights for our monthly report. The telephone calls at our front desk from last year at this time at 1,594 calls is increased to 2,246 calls. Our high cap insurance counseling was 137 last year at this time, and it was 184 for September. That was prior to open enrollment, which is Medicare open enrollment that began October 15th. So our numbers are steadily increasing now. Another highlight would be our transportation. This time last year, we had 139 units of transportation, and that is a one-way ride. This year, at this time, we had 184 units of service. Our PERS, our Personal Emergency Response Button, last year at this time, we were able to fund 148 units in people's homes. This year, we're at 172 units. another highlight is the other, which includes the COVID vaccine, scheduling, making sure people have transportation and getting to those, as well as home repairs and HEAP. This time last year, it was 188 units of service. This year, it's 457. So those are a few highlights.
A lot of increases, yeah. How many counselors or staff members do you have that help with that health insurance counseling?
We have 7 state-certified health insurance counselors who do one-on-one insurance appointments, as well as a Medicare Basics class at our office every month, and 4 times a year an evening class as well.
And this is certainly an important time for people who would be eligible for those programs to be looking at changes and or getting it for the first time, correct?
Yes. Anyone who wants to make a change who's Medicare eligible from October 15th through December 7th is open enrollment. And our insurance counselors will help them find a plan, and then it will be effective January 1st of 2022.
Okay. This is an invaluable service that you provide to Allegheny County residents at no charge, so it's pretty helpful. Yeah.
Thank you.
Anybody else have any questions for Anita? No? Okay. Okay, we've got a few things to consider, and one I believe is celebrating.
Yes, we would like to share a little information before we get into contracts. So we are delighted to be celebrating New York State Office for the Aging Older New Yorkers Day, and that is on Friday, November 5th. The event this year is again virtual, so you can log on to New York State Office for the Aging's Facebook page, or you can go to the New York State Office for the Aging's YouTube channel and watch the event on Friday, November 5th at 1 p.m. We will be having remarks from our state officials, as well as our New York State Office for the Aging Director, Greg Olson, and a moving presentation about our honorees across New York State for the volunteerism that they do. Allegheny County Office for the Aging is honored to nominate volunteer Kevin Harris for our 2021 Older New Yorkers Day. Kevin served with us at the Office for the Aging as a volunteer as a substitute Meals on Wheels driver for 9 years. He has also been a volunteer handyman for the last 4 years, where he has brought his professionalism in delivering on jobs and making sure that individuals have the services that they need to maintain independence in their home. So please join us to celebrate Kevin Harris as our volunteer nominee for Allegheny County in the 2021 Older New Yorkers Day. That's November 5th at 1 p.m.
That's awesome. Thank you. We want to say a big thank you to Kevin Harris and all that he's done, as well as all the other volunteers who work tirelessly to give the services that are needed for our seniors. Thank you.
Thank you.
Mm-hmm. Okay, we have a contract to an MOU first for the County Land Bank and the Office of the Aging.
So we are looking to enter into an MOU with Allegheny County Land Bank and the Office for the Aging to collaborate in an agreement with local trades programs at Genesee Valley School as well as Wellsville High School for juniors and seniors. This would be to provide, through our handyman program referrals, rehab services, so building ramps or handrails, steps. The trades students would be building those, and the referrals would come through our office through this MOU.
Yeah, sounds great. Great. We'll need a motion on that, please. Mrs. Burdick, second by Mr. Stockin. Okay, any discussion or questions about that? All those in favor, please say aye. Aye. Any opposed? That is passed. Thank you. And then we have a contract.
We are looking to enter into a contract with Erica Zerkowski, who is our registered dietitian. The state requires us to have a registered dietitian on staff or on contract for a minimum of 8 hours per week. We are looking at entering into this contract for 2022. The rate is still $60 per hour, which is the same as the 2021 contract. We are looking to extend this for a 3-year contract instead of doing a yearly contract.
Well, that's a good idea. Yeah, let's do them 3 years at a time. Motion by Mrs. Root, second by Mr. Havey. Discussion. Okay, all those, oh, did I see him? No. Okay, all those in favor, please say aye. Aye. Any opposed? That is passed. Thank you. A contract with Mark Waltag.
Our next contract that we're requesting to enter permission into and renew is with Mark Woltag to provide legal services for older adults. The rate is $75 per unit of service, which is an hour of service, with a maximum of $3,500. This is the same rate as 2021 and is a renewal from 2021 contract.
Okay, we'll take a motion on that. Mr. Habey, second by Mrs. Root. Any discussion on that, please? If not, all those in favor, please say aye. Any opposed? That is passed. Thank you.
Thank you.
Next one, total senior care, I believe.
The next contract we're looking at renewing and asking permission to renew is a request for total senior care for social day services through our Alzheimer's Caregiver Grant. The rate is $40 per half day and $60 per full day, with a $20 additional charge for personal care aid if needed. This rate is the same as the 2021 contract, and it is a renewal.
Okay, thank you. We'll take a motion on that. Mr. Habey, second by Mr. Stockin. And any discussion on that? All those in favor, please say aye. Any opposed? That is passed. Thank you. And we are on to the next one, Bolivar Country Club.
We're asking permission to enter into an agreement with Bolivar Golf Club as a food service establishment for the Go and Dine program, the restaurant Go and Dine program. The rate would be $12 per lunch and $13 per dinner.
Okay.
And this is accounted for in the 2022 budget.
Thank you. We'll take a motion from Mrs. Root, second by Mr. Habey. Any discussion about that? I know at a previous meeting, Mr. Graves had asked some questions to have a little bit of a report about that. So I wonder if maybe next month, Anita, you might be able to bring some of that as it's starting to get up and running and see how people are participating and how it's working out. I know it's not a year-long evaluation at this point, but I think Mr. Graves in particular would like to hear some of that.
It is on my agenda for next month, yes.
Great, thank you. Okay, then we're ready to vote on the Bolivar Country Club, I believe. Do we, Mr. Habey's looking at me like, we have a motion? Yes, we have a motion, yes, okay, let's vote. All in favor, please say aye. And no opposed, that is passed. And our last request to transfer funds, go ahead.
We are asking to transfer funds from our ADRC Vaccine Assistance Grant from contracts to pay compensation and VICA so that we can cover the cost of the employee that we have helping schedule boosters, regular vaccines, and as well as transportation or anything to get individuals vaccinated.
Okay, thank you. We'll take a motion on that. Mrs. Burdick, and Mr. Stockin, seconds. Thank you. Discussion on that? If not, all those in favor, please say aye.
Aye.
And no opposed, so that motion is passed. Anita, is there anything else that you have for us today?
There is something I would like to share. So we are putting out a press release for 2021 Operation Greenlight. I'd like to share a little information on that. Mike Hennessy was unable to attend today, and he sends his apologies, but he was able to work with me in coming up with a plan to promote Operation Greenlight. Operation Greenlight is to collaborate and bring attention to our veterans, regardless of age, and honor them in the service that they have provided to our country. So we are working with the Senior Foundation, and they gave us a donation to purchase green light bulbs that we will be able to distribute at our office through Veterans and the Office for the Aging. For anyone who would like to assist us with making Allegheny County glow green in honoring our veterans, we have about 120 light bulbs at our office. Mike Hennessy has reached out to the Veteran Services organizations and encouraged them to purchase their own, but we do have some at our office, and we are working with Veteran Services to promote and honor our veterans of all ages.
That's great. Glad to hear that. So they should contact whom
they can contact our office at the Office for the Aging. They can contact Veteran Services. Any of the post would be able to have some, as well as they can come right on into our office. They'll be in the front lobby.
Okay, that's great. Good to hear that. Yes, Mrs. Burdick.
I am aware of this program, and some of the other counties, I had forwarded to Carissa, they're actually lighting up their county buildings in green. And I wondered if that was anything I know I forwarded to Carissa, I don't know if she's had a chance.
On top of that one, I believe DPW's prepared to illuminate the old courthouse building and the Vietnam Memorial off to the side, so they're ready to go.
That's great. And let's give the date again that's going to happen.
We honor our veterans for the entire month of November. We will be honoring it for November 7th through the 13th is the time frame that we have put in the press release to come into our office to get light bulbs. That's the week of recognition. But if we have more light bulbs available, we will be offering them all through the month of November.
That's great. And is there a particular date that the courthouse is going to be lighted?
I asked DPW to look at that entire week, but I don't know what they've decided on. I did not ask them that.
Maybe there could be a short press release about that when we know the dates of it. I think it'd be something that people would want to see. It's like looking at the Empire State Building all lit up, but it's the courthouse in Allegheny County, so. Yes, Mr. Healy.
Yes, I'm sure it'll be lit up for, on Veterans Day, right?
Correct.
Yeah, thank you.
That's great. Good. Good news to hear. Thank you for sharing that.
You're welcome.
Okay. Anything else you want to share?
I think that's it.
Okay. We thank you for being patiently waiting and giving us your good report. And I want to thank the committee as well for your perseverance and being able to handle a lot of business in a very short period of time. Mr. Barnes, you have a comment?
I just had a question for her.
Oh,
if
she's
you
right
walk-
here. She's still here.
Sorry.
This is looking ahead. Are you tentatively planning for a senior picnic next year?
I can't answer that right now. Next year is a long ways away, and I am not sure what will happen between now and then. My hope is that we will have a senior picnic. What it will look like, I can't clarify on that right now.
I understand that. I just wondered if it's even in your thinking
It's always in my
resume it.
thinking.
It's always on their radar, right?
It is, and it broke my heart to have to cancel it, but it was for the safety of our older adults in our community, so. My intent is to.
So
We will see
wait
what
and
the
see.
world brings to us.
Okay, thank you.
You're welcome.
Okay, thank you very much, Anita. Is there any
You're
old
welcome.
business for today? Any new business? Go to the order. We'll take a motion for adjournment. Mrs. Root, second by Mr. Stockin. We are adjourned. Thank you very much, everybody.